Welcome to another episode of Real Talk with Dr. David Samadi. We have a special guest for you, someone who is from completely different sect. We've talked about medicine, we've talked about journalism and politics, but we really haven't had any guests from the insurance corporations. And today we have the pleasure and honor of having Laura Peña with us, who's been a prominent businesswoman, someone who's been visionary and has really changed the world of insurance company in this country, in Dominican Republic. Laura, it's a pleasure to have you with us.
Thank you.
And we'd love to learn from you because I personally have so many questions about the insurance companies, certainly in America, but also in Dominican Republic. You also serve as a president of Comparte, which is also a very important company in this country. So we'd love to hear from that. First of all, tell me about the whole family involvement in insurance companies, how you got involved in this, and how things are going for you.
Well, first place, Dr. Samadi, thank you for inviting me. It's an honor to be in your podcast today.
It's a pleasure.
And let me talk to you about my family, like you said. My mother was the one who was the founder of Peña Izquierdo, Corredores de Seguros. But before that, when I was little, all of my aunts, uncles, they always talked about insurance because they were involved in the insurance sector. They were insurance companies or they were agents. And I always heard of them talking about claims and all that. So I really liked the theme and I was always hearing them talking about that. So when I went out of school, I decided to work with my parents because my father went to work with my mother also. And I told them if I could work with them. And they said, sure. And I started to work with them in the health insurance business. So when I started that, then I said like a couple of years after I started to work with them, after I finished my bachelor's degree, I decided that I really wanted to go in a master's degree to learn more about insurance and the theory about insurance. And I went to Hartford, Connecticut, which in that moment, it was the capital of it was insurance capital of the world.
That's interesting.
Yeah. And I went to University of Hartford to a Master's of Science in Insurance. I was there for a year and then went back to the business, to the insurance broker business with my family. I was more mature and I had more knowledge about insurance so I could have my clients very well represented. We work all types of insurance. We work with property insurance, we work with health insurance, life insurance. So it's a broker with all the types of insurance. I really, really like most of all the health insurance because with health insurance you can get with the client like very, very near the client.
Intimate.
It's very intimate because it's a sensible type of insurance.
Health insurance companies, at least I can talk about America, have always been a little bit of problematic. I can talk about the doctors. Of course, they really help tremendous millions and millions of people. But let me talk to you first about the voice of the doctors and the complaints, and then we come to the other side.
Okay.
Because the doctors also could be very demanding, and sometimes they could be unreasonable. But it's been always an issue because you do the surgery, you can bill for, let's say,
Sure.
$30,000, $40,000, and then you get like a tiny little check for like $1,000 for the work that you've done in the operating room. And that has really taken the incentive away from a lot of doctors trying to do a good job. I don't think they should be working for money, but I also think that they should get paid for what they do. Do you see this as a problem in this country? And then we get to what they cover and what they don't cover.
It's the same system in Dominican Republic. But let me tell you, if a doctor signed a contract with an insurance company, they signed the contract about what are the ordinaries they're going to be paid, right? So if they got engaged with that insurance company, the doctor should be satisfied with the payment. So if the doctor is not satisfied with what they had in the contract, they just have to go renegotiate, right? But because what insurance does is that they get a lot of volume, right? Because a doctor that is not known, nobody knows a doctor, he gets in the network for the insurance company, and that doctor will get patients, right? Correct. So it's like a win-win situation. And the doctor has to put in the contract how much he's going to receive, and the insurance company should negotiate very well. If not, then the doctor should go out of network and just go private. Like there are a lot of doctors doing that here, and a lot of doctors doing that in the United States.
Which is, I'm one of them. We basically have been out of insurance, but we work with some insurances to really help the patients.
It's free market.
Correct. That's so true. So let me tell you one of the issues that I had about 25 years ago. As you know, I do robotic surgery for prostate cancer. And I may have helped some of your clients or patients over the years. For the first 2-3 years in America, they would not even agree or admit that robotic surgery even exists. That was like in 2002, 2001. And it took like few years with a very low ball numbers. And now it's the last 10 years, 15 years that really insurance companies across the board are accepting robotic surgery, not only for prostate, but for everything else. In this country, we still have some problem with that because obviously we started about 12 years ago with robotic prostate at homes. Now more and more hospitals are coming to this. What do you think the issues are? They approve open surgery.
Yes.
One that cuts patient open, one that has transfusion, one has...
And the patient will be longer time in the hospital.
Longer recovery. So I'm just... Forget the insurance company, forget like Samadi for a minute.
Okay.
A doctor with a insurance side. Why are we not rewarding the quality? Of course, there are robotic surgeons who should not be touching the robot because nobody cares about open versus robotic. You care about the quality, and you have robotic surgeons that spend 9 hours doing something and an open surgeon can do in an hour and a half, and vice versa. But if you have a qualified surgeon who is doing robotic surgery, no transfusion, faster recovery, better outcome, why are we not recognizing it, or why are we not rewarding it, and we still pay for all these laparoscopic things that are already passé and old and open surgery?
They're already old, yeah. I think it's a process, like it was in the United States.
Correct.
To get the surgery, the robotic surgery approved by the insurance companies. Technology, it's very hard to get it approved in the insurance sector because it costs. And as it costs, then the premiums will go up. So I think they will do it, but they're very slow.
Matter
approving.
of time.
Yeah, it's a matter of time. And what I've seen in this country, it takes a long time to get technology approved in any of the surgeries that they're doing right now because of the premiums, because of the cost. Because definitely it's better for the patient. We will not discuss that. It's much better. The patient gets a great recovery. They go out of the hospital in a day or two.
Correct.
And they'll be back working in maybe 2 weeks
Exactly
or so?
right. And Laura, it's a less burden on the healthcare system, whether it's in America or Dominican Republic. Exactly what you said. You're getting the patients back to the system, and it's a longer term. It's a lot more saving for the patient and the system than keeping them in the hospital for a week.
Yeah.
Make your job harder, make it more expensive for you guys, etc. So it's something to consider.
It has to be considered. I'm really agree with you, but what I see in the insurance market is that they are very slow approving technology surgery because they will get higher premiums. And what will happen, maybe the patients won't be able to pay those premiums. So that's why they have to work. They have to see that it really works, that the FDA approves it, and then they will get it in. They will put the premium that will pay those kind of surgery. And definitely some clients will pay it, others will not pay it. Here in our country, some plans cover the robotic surgery, but others plans that are with lower coverage, they won't do it because people don't have the sufficient
finances.
To pay for that kind of premium.
Laura, in America, we have, I want to learn from you, we have a major problem. Medicare and Medicaid is at the verge of bankruptcy. They're talking about 2035, we may actually lose, the whole healthcare system can collapse. We are opening up every instrument that the surgeon asks, and so we have unlimited resources the way it is. And so the system is not sustainable. The men and women, our elderly population are getting older, which means that there is a higher burden on the healthcare system. There was a time that 70-year-old was an old age, and now they're going to their 80s and 90s, so they're
That's right.
making your life much harder.
Yes.
How do you see that in Dominican Republic? Does it follow the same trend? And what was the discussion among you private groups to deal with this kind of issues in Dominican Republic?
This is happening around the globe. It's not particular of the United States. It's not a secret that we're living more. We have better quality of life. We have more medicines. We have more technology to treat our sicknesses, our diseases. So we have to work very well on how we finance insurance, so people can pay insurance after they are old age, and more people come in the system. Young people come in the system, so they can feed the system. So it's very hard. Our Social Security system started in 2001. We had the new law. And then we started on the health insurance in 2007. Right now, what we're looking after the 2020 pandemic is that more people are going to the doctors. More people are going to the hospitals. Because before 2020, people would go to the hospital. Maybe they were feeling very bad.
Right.
But now if they have a flu or whatever, they will go to the doctor because they might think it's COVID or something else.
That's true.
And the claims are increasing and the premiums are increasing because we have a higher utilization of the insurance. So this is a global issue for everybody to think what we're going to do so our Social Security system don't go bankrupt. United States is a very complex system because it's very expensive. The providers are much more expensive than in Dominican Republic. Before we started the program, we talked about health tourism, and that's what Dominican Republic is promoting because we have great doctors and we have a lower cost. I know a lot of people who live in the States and they come here to get dental procedures.
Dental and plastics.
And plastic
even
surgery.
Cancer surgery
yes,
sometimes.
because they are cheaper and we have great doctors to do it. And so the United States has to check their system on the cost. The cost of the system is too high. If you compare what is hospitals fees in the United States to the Dominican Republic, we're talking about like 10% is the cost here in the Dominican Republic, so what would cost in the United States. So it's very difficult, the challenge that the USA has.
I would love to work with companies like yourself to really, and people like you, to increase the medical tourism one way or another. Even especially even we can work on like Dominicans who may or may not be able to afford or don't have it.
There are a lot of Dominicans who don't have international health insurance, and they have to get whatever they have, if they have surgery, they have to do it here.
Correct. That's true. Recently, some of the other insurance companies have been in the news. I was in New York and I was seeing that there are changes happening in Sanasa and other insurance companies. What exactly is going on in DR? Are the insurance companies in trouble? Are they having difficult time covering the patients?
No, we have a very healthy insurance market in the Dominican Republic. Financially very strong, all the companies that participate in the market. But what's going on is that the Social Security system, which is totally different to the private sector, it has a limited financial premium, because this comes from the pockets of the company and the patient or the person who is part of the network. So it's very hard to get the system to cover the premiums that they need. So we're working on the system to try to doesn't go to bankruptcy as is happening in the United States. So we have to get the premiums, we have to get them up to date with the technology that we're using now, so that the insurance company can get the money and continue paying claims. So that's the issue with the Social Security, because the private sector doesn't have any issue, because the free market, you get premiums higher if you get more cost. If your insurance cost goes up, you raise your premiums. If your costs go up, you raise your premiums. But in the Social Security market, you can't really do that because that's regulated. So it's very hard to get it up.
When, I've been coming to Dominican Republic for almost 12 years. Of course, the first few years, we were not really much involved in the backbone of what's going on. We were coming, doing our surgeries and taking care of the patients, and it was fine. Recently, I can tell you in the very, very few of patients, one of my patients ended up in the emergency room. And what I was surprised was, we had to give IV antibiotics, for example.
You had to?
Giving them IV antibiotics because there was a little bit of an infection. And they said, doctor, there's no antibiotics because the insurance company has to approve it or the patient family have to buy it and bring it. And to me, this didn't make much of a sense. This idea of authorization in the cases where there is an emergency, in America, we don't think like this. Even though they have to be all authorized, etc., we take life immediately, give the antibiotics, and then send to the insurance company. Exactly right. Exactly. Is that
that's not
incident
the way.
That's not the way it's done, or
that was particularly for that case, because what we do here is you get pre-approved before surgery. And that's how we do it in the United States also.
Correct.
You get a pre-approval from the insurance company because they have to see if it's pre-existing or not, or they have to check the contract.
Correct.
Okay, after you have the surgery approved, you have your surgery approved. If there's an emergency during surgery,
it's all included in that.
It's included because it's part of the surgery.
I like that. I like to hear that. So
it
maybe,
is like that.
Maybe there was a mistake in some people's part.
I don't know what happened in that case in particular, but an insurance company will not. We're not play. With the life of a patient.
I wanted to get that out of the way. One of the important questions that has come up is the issue of illegal immigrants.
Illegal
immigrants. So certainly in Dominican Republic, you're talking about a lot of people from Haiti, from Venezuela, and of course in U.S. we have our own issues. When you have someone, whether they're legal, illegal, they have insurance or don't insurance, they fall, they hit their head, they come to the emergency room, no question asked. We don't ask like, hey, do you have an insurance? They go straight to CAT scan. This obviously is not sustainable because long term, this is going to add tremendous amount of expense on the hospital.
Yes.
Whether or not they're going to get paid or not, who knows? But we treat everybody like an open check. Do you have the same problem over here, and how are you dealing with this?
Sure. We have, imagine, Dominican Republic has limited finance for health issues. Imagine for our population, imagine if we do it for our immigrants. But there's nobody sees if he's immigrant or not. They get attention. Last year, President Luis Abinader, he gave the order that you have to stabilize the patient. It doesn't matter if he's immigrant or he's Dominican. You have to stabilize. That's law. You have to give your attention.
New. That's great.
And then after you get that patient stabilized and he's illegal, then you have to work with that issue for that patient to go back to his country. But you can't say, I'm not gonna give you the emergency attention because you're an immigrant. Here we have higher costs and expenses because we have a lot of immigrants going to our hospitals, giving birth, and we need money for our population also.
It's a big problem.
Yeah, it's a big problem, but the human part is the most important part.
One that local people probably will say, how am I going to deal with this? Because it's going to come out of someone's pocket and our taxes are going to go up. And why am I paying for? I understand the human part is absolutely like something that will take priority, but it's something that almost every country has to deal with.
Almost every country. We're not the only country that has the migration issue. There are other countries where Dominicans go to the United States. They migrate also because of labor issues and all that. And it's happening in Europe. It's happening all over the world. But every country has to take their migration laws, and apply them.
100%. They're all connected and somehow intertwined. The issue of one insurance for the whole country, and the concept of Obamacare that came like many years ago, which was like a complete red flag to most doctors that I know of. And the fact that, you know, it's a compassionate way of thinking for everyone to have insurance. So whether it's the human right or whether you have to earn it, and this is a debate that goes on between the Democrats and Republicans all the time. And when you talk to Bernie Sanders, he wants to give away the entire thing for free and make sure that everybody is on board, which of course I'm a little against that, because I think that you know, quality is extremely important, and when you basically bring everybody for free on board, it will cut down on the quality as the quantity goes up. So we have to find some way to be able to take care of the mass without jeopardizing the quality.
Well, in the Dominican Republic, we have about 98% of the population in the health insurance for the Social Security, because we have two types of insurance. We have the contributive, which is everybody that's on a payroll.
Correct.
And then you have the subsidiary, which is the one that the government puts. And those people who are in that type of insurance, they go to hospitals.
For an emergency basis, they have something to cover them.
They go to emergency, but not only emergency. They can go for any type of attention to the hospitals, and they will be covered by the government.
And are there going to be charges after they leave, or it's all completely
after
covered?
They leave. And normally it's 100% covered.
Well, that's good. Mm-hmm. That's a good system.
But they go to the hospitals. They don't go to private hospitals. They go to public hospitals. Yeah, because the government is paying that for them.
Do you think that there are two healthcare systems that are completely, you know, different? If I go, for example, like to a public hospital, I may get a different kind of care as opposed to the
It's what you're saying. The quality is much different. I mean, you will get much quality on the private sector than you will get on the hospital. But what we have gained with the Social Security system that we have is like a democratization of the health insurance. Why I'm saying this, because in a company, even let's say the messenger or the owner of the company, they can go to the same hospitals.
Correct.
And that's democratization and access to health insurance, quality health insurance. The part that goes to the hospital, to the public hospitals, are the people who don't work. So that's a solution that the government
to support everyone.
To support them.
Laura, I want to ask you about, like, you know, a system of, you know, the 401ks, retirements that we have. I always like think about how do we fix the issue. You know, people in their 20s, 30s, 40s, even like early 50s, they may not get sick, but yet they're paying tremendous amount of money into the system. And they may see somebody for flu that will cost like $100, and meanwhile they're paying like these premiums that are in thousands of dollars in U.S. So if you add that, and somebody asked, well, if David Samadi was the Minister of Health and had to make decisions, I was always that's why I want to know if it even makes sense to you or not, a proponent of having, you know, a saving account, medical saving account, or like sort of like your 401k kind of a thing. So when you get to your 60s and 70s and you need to have your robotic prostate surgery or your, you know, fancy stuff, you pay the doctor out of your saving account what he is asking for. The doctor is going to be happy. You have the funds. So if you have a basic insurance that's going to cover all the emergencies, but then instead of giving this to the government or insurance, etc., you will have this account, work with insurance companies, so later on you have the fundings to pay for it, and incentivize medicine. So if I want to have a cheeseburger and they make it supersized and more French fries and I become more obese, etc., if it's coming out of my pocket, I'm going to say, wait a second, I got to take care of my blood pressure, or I got to take care of my weight. What do you think about this? Is it even like practical, or it's just like a theoretical stuff?
Well, let me put it the other way around. Imagine that we have that savings account, right? And I have basic insurance. And I get sick very young. I don't have anything in my savings account. So that's why we have insurance, because you never know when you're going to get sick. You might get sick old or young, because sickness doesn't have like a tag on the age. That's what we're looking at. We're seeing so many different kind of
Chronic
diseases and
diseases.
chronic diseases affecting young people. So I don't think the savings account.
You don't think it's going to work?
I don't think it's going to work. Really, I think that premiums.
I lost one vote already here for a campaign. You see how that goes, right?
Well, I see that it works with the age, and my clients always tell me, okay, my health insurance is already very high and I haven't used it. And I say, thank God you haven't used it. It's for not using it, because if you use it, you're sick. But really, what people look is that as you get older, you get higher premiums, because that's what the statistics show, that older people might get sick.
True.
So that's how it works. I don't know if the other way around will work. Not for your health insurance, not for property insurance.
See, I'm learning a lot from Laura, and it's a question that comes up, and a lot of you probably are asking the same question. So obviously you are in a very competitive field. You're dealing with a lot of companies that are doing similar work, but you have been in this field for decades, and you've been quite successful, and I have tremendous respect for you.
Thank you.
Maybe you can talk to the camera directly and speak to the youth and the young girls, men who want to get into this business. They're afraid they may not make it. What is the lesson that you learned over the last 30 years that you want to tell them? Maybe work hard or not give up, or what is the key to the success in this field, and what message you have for the public?
Working in the insurance field is really very passionate, because you can see the rewards when you give an insurance to somebody, when you sell an insurance that person validates, and that if they use it, they feel gratitude, because they wouldn't have paid the health problems without insurance. So we're helping people get covered, people who in any other means couldn't get coverage. So it's very rewarding to work in the insurance sector when you see how people will get back what they paid.
Thank you very much. And I'm very happy to see that, a lot of times when we think of insurance companies, we think that they just don't want to approve something, or there's some coldness when it comes to that. But I'm very happy to meet you. I'm very happy to see that
Thank you.
There are people with heart behind in these insurance companies that really want to do the right thing for the patient. And that's tremendous, because we are in the same team, both physicians and insurance companies.
We have to work together.
100% have to work together. And the goal is to really help you save your life, extend your life, make your life a better quality. So Laura, it's a great honor, and it's a pleasure to have you with us.
Thank you, Doctor.
And I think a lot of people, not only in Dominican Republic, but also in New York, are going to listen to what you have to say. So it's a pleasure, and I appreciate you spending time with us.
The pleasure is mine. Thank you
so
much.
Thank you.